And that next stage is that if we're satisfied within 90 days of the presentation of the petition, we have to conduct a referendum. A referendum basically is a yes or no answer on the ballot paper. It's not, so it's a, do you want your representative recalled? If 50% of the total number of registered voters in that constituency, in that referendum now come and say yes and vote for it, then we will have to, the person stands recalled, in which case INEC, the commission, will now have to write to the presiding officer. If it's the Senate, to the Senate President. If it's the House of Reps or State Assembly, we now write to the Speaker of the House of Assembly and say, look, there was a petition received, it was verified, we've conducted a referendum, and truly the people in this constituency, more than 50% of the registered voters have agreed that they want to recall this person. Will now give that letter under the hand of the chairman of the commission to the presiding officer, who will now take it for the House, and that person stands recalled. So it's not just a simple yes or no vote. It's a simple yes or no vote, but 50%, not just of those people who came out for the referendum, but all registered voters, 50%, once they have signed, that's it. But we have not had that in the country yet. In practice, quite often, the people being sought to be recalled rush to court, get some kinds of injunctions. So we've not actually gone on to the stage of referendum in many cases. But in a few cases we have. Even when the present governor of Plateau State, Simon Along, His Excellency, was the Speaker of the House, some constituents sought to recall him. He went to court, but the court agreed with INEC. We went to conduct a referendum, but it wasn't successful because the people, obviously his constituents, still had some faith in him. So they did not get, those who wanted him recalled did not get that 50% threshold that is required of registered voters that is required. So about 2 or 3 cases have gone on to the conduct of a referendum, but a lot of the time, some of them in verification stage. We cannot verify the signatures because they are forged, or people have some printed when they can sign, or we're not satisfied. And other times we've gone on to recall. That's the position.
In practical terms, Nigeria has never experienced a recall in its democratic existence, unlike in the United States, where about 26 legislators have been recalled, including that of the president of Arizona Senate, Rosel Pierce, who was recalled in November 2011. Since the return to democracy in 1999, the National Assembly and some state assemblies have several times witnessed agitation by a section of the society against their representatives. One then asks, why demonstration instead of going through the constitutional means?
Well, I would say it has not been, practicalized. There are no clear examples where if you go through that process, it actually ends up in the removal of a member. But like the constitution is clear about it and the procedure, there has not been any test case whereby some constituents, follow that procedure and actually achieve, the end result. But that is the procedure in removing a member from office. You get the requisite signatures, which will be verified, a referendum called within 19 days, and that is the process.
But to my mind, you see, from the beginning of 1999 up to today, I have not seen where electors succeeded in recalling a member, because the process is very cumbersome and difficult. So the only thing, maybe they will only succeed in harassing a member and then disgracing him, which some of them you will find out that it is ill-motivated, because to be very honest with you, at times they will be asking you things that you cannot even fulfill. While some, I credit some of our colleagues or members with the blame, because during electioneering campaign, they go there to say that they will do even, they will give him honey and milk. They don't know that actually a legislator doesn't have a vote. Once you don't have money that will be allocated to you, you cannot perform. Some will go and promise them that we'll do road network, we'll do this, we'll do that. At the end of the day, if he comes into office, he realizes that, look, he doesn't have that money. What does he do? So these are some of the difficulties that we are having.
And that if they have good reason to embark on the process of recall, they should be able to effect that process. And the only way they can effect that process is to simplify the procedure, but not too simplified to be invoked by people who don't mean well. And I think this is where we need to take clear look at the provisions surrounding impeachment and see what we can remove and how we can simplify the process, but simplified in such a way that it is not open to abuse. Because the greatest fear, and I'm sure why the Constitution decided to make the process very rigorous and cumbersome, is to preclude possibility of abuse. You see, democracy is a very interesting project, particularly the liberal democratic type of democracy we are practicing. What makes democracy interesting is that election does offer citizens the opportunity to express their franchise, to be able to determine who their leaders are, and to exercise their sovereignty. But you know that even when you have the best of elections, even when elections are credible, even when elections have integrity, even when elections are free and fair, there is always a deficit. And the deficit is that election happens every 4 years or periodically, and that in between, voters and the electorate become very useless in terms of enforcing political accountability. And that is why the literature on democracy increasingly recognizes that the litmus test of a democratic society is not the credibility, the freeness, and the fairness of the electoral process, as important as it is. You need to go beyond that to have a deepened relationship between citizens and the people they have so elected for that period, and be able to demand accountability from them. Because once they cannot hold them accountable for their actions while in office, the whole notion of democracy disappears.
Recall in Nigeria is seemingly visible only in the text of the Constitution, as what could have been a process of recall has ended up as a demonstration at the entrance of legislative houses in Nigeria. Well, coming up next is a public hearing by the House Committee on Public Accounts, where the Auditor General of the Federation raised a query against the Nigerian Air Force. Public Accounts Committee, where the Auditor General of the Federation raised a query against the Nigerian Air Force in 2010 for making payments amounting to 1.9 million naira in checks instead of e-payments at the Nigerian Air Force Station, Calabar.
To advise the committee, if we know that issues are very clear and you try to rigmarole, clearly it sends a message. So I will advise that even where the query is correct, kindly admit so that we can make progress.
Nigeria Air Force, paragraph 5.10. At Nigeria Air Force NAV Station, Calabar, it is observed that 22 checks amounting to 1,090,538 naira 69 kobo were raised and paid to non-commissioned officers via various commercial banks between January and May 2010, contrary to the provision of the Federal Treasury Circular number TR/AS and B8/2008 and OAGF/CAD/026/Volume 2, paragraph 465, which states that all government accounts shall be non-check accounting. This is a flagrant violation of financial regulation and regulations on e-payment, which took effect from 1st January 2009. The Public Secretary has been requested to explain why disciplinary action should not be taken against the Nigeria Air Force in consonance with the provision of Financial Regulation 3127 and 3128. Its response is being awaited. This is viewed as a violation of Section 85, subsection 2 and 4 of the 1999 Constitution and Financial Regulation 110, which gives the Auditor General or his representative free access to books of accounts and information at all reasonable time. Consequently, I could not perform my statutory function on the division. The Permanent Secretary has been requested to justify this disregard to constituted authority and laid down regulation, but his reaction was not received up to the time of compiling this report. Sanction for making payment with cash, check organization. Any organization that makes payment by cash or check without having been exempted from e-payment policy shall have his budget allocation suspended. 3128. Any officer who makes payment by cash or check without relying on exemption from e-payment for his or her organization shall be deemed to have committed a gross misconduct and shall be disciplined accordingly.
The Chief of Accounts and Budget at the headquarters of the Nigerian Air Force, Clement Obeche, responded to the query.
Payments were the first salaries due to the non-commissioned officers after graduation from training. As at the time the payments were made, the soldiers' individual salary account numbers were not yet available from the various banks. Being fresh graduates who had no other source of income, it became incumbent on the unit to act in the manner that it did in order to alleviate the consequences of the personnel not earning their salaries. It was our view that inaction on our part would amount to action against the morale of the troops. The observation of the Auditor General is noted, and our action under the circumstances is equally regretted. The unit will do all in its power to guide against future occurrence of such violation. May I note, sir, with due respect, that the photocopies of the relevant vouchers and the copies of the 22 checks are attached. However, the checks amount to 1,121,738 naira 16 kobo and not 1,090,538.69 as stated in the query. The mitigating circumstance was because the banks refused to honor our letters to open accounts for them, insisting that they must pay a deposit, which they did not have. So since their salary came, we had to use the checks, which is an equally accepted legal tender, and no revenue or government fund was lost in the process. The federal audit team goes round, and the resident federal audit team with the Air Force audited the accounts for that year.
So we therefore discharge you, Nigerian Air Force, and then we hope to see you again in the very near future to answer to your 2011, 2012, up to 2015 queries.
The committee, however, implored them to encourage service delivery by public officers in the line of duty, as the military is noted for the promotion of discipline and execution of work.
Let me also assure you that we are not unmindful of the challenges that you have been facing on behalf of all of us. However, like I told you, and indeed everybody here, what we're also carrying out is our own constitutional responsibilities, just like you are carrying out your own. And let me also tell you that so far, I'm sure that as we speak on behalf of Nigerians. We're very impressed with your performance so far, and we want to commend you. We pray that you continue in that spirit.
The concerns being expressed by Nigerians to their representatives in the National Assembly on the outbreak of meningitis C, which has resulted to the death of some people, and the best ways to contain this epidemic are part of reasons for this interactive session.
The committee members expressed the need for a more proactive measures to be taken to contain the spread of meningitis serotype C to other parts of the country.
Over the past couple of days, as members, as representatives of Nigeria, and in particular as members of the Healthcare Committee on Healthcare Services, we have received numerous reports, calls from Nigerians, from our constituencies on meningitis, which has been claiming a lot of lives, and which records, official, we don't know the unofficial, claims almost over 300 lives, 326 lives of Nigerians have been taken. And this disease, meningitis, which is not new to Nigeria, which has been in Nigeria for over 30, 40 years, ago, has devastated, in particular, about 5 states, namely Zamfara, Sokoto, Katsina, Kebbi, and Niger. Again, there's report that at least about 16 states have also recorded at least 1 death within the past couple of days, really. This is a serious thing, really. Like I said, as representatives of Nigerians in the parliament, we are really worried. We are really disturbed. Now, 2 major federal agencies under the Federal Ministry of Health are charged with this responsibility of the control, prevention of meningitis, just like other several diseases afflicting Nigeria. In fact, if not for what really happened, I thought meningitis had already been eliminated a long time, ago. But, to our dismay, this thing is really, people are dying. And like I said, nobody knows so far the number of people who have died. And report has it that even in Abuja here, whether it's true or not, we hear, from you, some people have also lost their life. As a committee, we are not really happy. It means something is really wrong. Does it mean that the 2 agencies did not really anticipate that this thing is really going to happen? What really happened? We know that on an annual basis, a lot of money, billions of naira, we here appropriate, approve, for the purchase of vaccines of various kinds to address and combat a lot of these diseases that are really happening. So it's really sad. So members of this committee would want to find out. That's why we invited you as a matter of emergency. So that let us really hear from you. What went wrong? Whose fault? Was there no money? Why are we witnessing this number of deaths in Nigeria today? So that is why my distinguished colleagues, I believe I have really introduced the subject. That is why we invited this emergency meeting.
For Katsina, Kebbi, Niger, Sokoto, and all these states and the northwestern zone of Nigeria. But the major thing I really want us to notice is that the most common serotype, which is actually causing this this outbreak, is serotype C, and it takes about 93% of the tested confirmed cases. So we can say this particular serotype has not been in existence before, so we are just currently experiencing it. That's the reason why we have so many cases, more than 2,000 cases, and more than 300 cases in the last couple of weeks. So as at the 3rd of April 2017, we have a total of 2,987 cases with 336 deaths, which have been reported. and we have 146 confirmed, vulnerability confirmed cases. So I just want to quickly talk about our response so far. Because of the magnitude of this outbreak, the leadership of the health sector, the Honorable Minister, directed that we have to step up higher than what we were doing before in the area of response. And EOC, Emergency Operations Center, was quickly activated with IMS system mode being in place. So this means that all the efforts from all the partners as well as the states are being coordinated in IMS mode system, where we have the incident manager, which is my humble self, and we are coordinating all the activities in the states to be able to, ensure that we combat the disease. So we have about 5 different components of it. We have the surveillance and the risk assessment unit. This group of experts, they are working on the active surveillance and the risk assessment. Then we have epidemiology as well as the guideline development, which will guide each state on what to do and how to work perfectly on it. Then we equally have a communication system, and these communications, they are already at work. You will agree with me that you have been hearing it on radios and televisions and all the social media on what they should do if they suspect any case of meningitis. Then we equally have vaccine and medicine procurement. These experts from all the partners as well as the national level, they are working day and night on vaccine procurement, vaccine distribution, as well as supplies. So these pillars or components under EOC are being coordinated in the IM system, and we are working day and night to ensure that each state are given the necessary materials to work with and then get the necessary results by responding to the outbreak and then bringing down the number of cases of this disease as well as the death. So these are more what we have been doing, and we hope that within a very short period, because this EOC has just been activated because of the magnitude of this disease, and we hope that within a very short period, this disease will be contained, and then we will be having zero reporting, and everybody will be happy with it. We'll talk about the communication aspect because it's very, very important at this level. We have UNICEF supporting us in the social mobilization activities targeted at the grassroots, which is being implemented in all the 5 states. So we have all our people in those 5 states. They are actually supporting the rapid response team in each of the states in terms of investigation of this particular disease, in terms of containment of the disease, in terms of active surveillance. So we are equally engaging local and global media proactively to drive strong national narrative and also align Nigerians with the preventive measures, which is very, very important at this point in time. So we have media engagement on traditional social media channels, and digital tools are being deployed for this response. And we will have a toll-free call center to all Nigerians that they will call in, and then somebody at the other hand will tell them exactly what to do. So we are actually working on preventive strategies as well as case management of this disease.
There's a difference between what is happening now in terms of the actual cause and what used to be. Now, it used to be meningitis caused by serotype A over the years, which had constituted over 80% of the cases. Between 2011 and 2015, the National Primary Care Development Agency, along with stakeholders, worked assiduously to implement campaigns in all the states against the type A. And as a result of this, meningitis caused by this particular type, which had been responsible for so many deaths in the past, has been virtually eliminated. And you also spoke about the need for preparedness or otherwise. Now, because this particular serotype that is responsible for the current outbreak is type C, which hadn't been the case. We hadn't had outbreaks caused by type C in the past. Nevertheless, the National Primary Care Development Agency did some forecasts and reserved 500,000 doses in case of a scenario whereby the disease, the meningitis caused by this type happens. And then there's an outbreak this year due to type C. You may wish to know what we have done and the plans and what else we will be doing. Now, we distributed the 500,000 doses to all the states that are affected in this, that are involved or afflicted by this epidemic. In addition to that, in fact, vaccination is beginning today using the 500,000 doses that have been distributed. Vaccination is starting in Zamfara State today, and our state team members are on ground, state coordinators, zonal technical officers who are on ground, on average of at least 4 in every state of the Federation and FCT. So they are on ground providing support to the state teams on ground, along with other stakeholders. In addition to that have been distributed, we are expecting 823,000 doses, from the UK, and we expect that will be delivered any moment from now. As soon as they are delivered, we will again distribute them to the affected states. Not only that, because of the situation on ground, the National Primary Care Development Agency, and as a matter of fact, I can say the government of Nigeria through the National Primary Care Development Agency has made contacts with Sanofi Pastors, a company that manufactures the type C vaccine in India, in a relationship with UNICEF as well. Made contacts for sourcing and supply of 2 million doses. That too, once it arrives, it will also be distributed. There is one thing I also have to say. Because of the nature of the serotype C, the bacteria that causes this condition, the vaccines are not freely available. It's not a common type, and even its distribution and availability is controlled by International Coordination Group through the World Health Organization. So that is the situation so far, and as soon as these vaccines I mentioned earlier arrive, we will distribute it to the states. We are also making arrangement also to provide not just the vaccines, but the supporting material, devices, injection materials, reconstitution materials, as well as safety boxes to ensure that the environment is also taken care of under the present circumstance. Thank you.
The members also raised concerns on the late commencement of immunization in the affected states, availability of the vaccine, public awareness campaign on the disease, with focus on the primary and secondary schools, and the establishment of emergency operation centers.
Relates to your agency, just note it, and then when you are asked to respond, then you respond.
Know that meningitis affects mainly children and the elderly. And I think so far most of those that have died, I believe, are probably children, or a huge number of children are involved. What are you doing to ensure that primary school children in schools are well enlightened? And when the vaccines do arrive, are you going to have a policy whereby every year children are vaccinated in schools, primary schools, against meningitis? I think, like they say, prevention is better than cure. So what have you put in place? What measures have the Centers for Disease Control and the Primary Healthcare Agency taken, number one, to boost the enlightenment, especially among children and the elderly, and the population, and also to ensure that they get the access to the vaccines in schools. Thank you.
How many emergency operation centers do you have? Do you have in each state affected, or you have it in only one place, and from there you are carrying out the process? That is one. Number two, the vaccines that have been given and those expected, are they curative or preventive? Because if we want to control, the best way is to give vaccines that will prevent, it taking place. So these ones that you have given, especially the 500,000, I believe that would be to cure those that have been affected. And the 2 million that we are expecting from India, since they are specifically for serotype C, are they to prevent the infection, or they are also to cure? Because we do not hope that we will still have about 2 million people having the condition by the time the vaccines come. So I really want to know.
And secondly, I just want to ask also the primary healthcare, looking at the vaccine, when we talk of meningitis vaccine, I think we used to appropriate money virtually everywhere for the recruitment of meningitis. And looking at the immunization of meningitis, in which if a child is being immunized, at least maybe he used to develop that immunity for other 3 years, I think if I'm correct, 3 years or there about 2 years. In as much as primary healthcare are providing or are procuring the vaccine, and they have been vaccinating the people, why are we having this meningitis at this time? Looking at the fact that we all know the nature of our country, in which there is this hot season and there's also Harmattan season, in which the meningitis virtually comes around this time. Why are we taking it this one where have the problem that we'll be having the fire brigade approach? Because I just look at it as the fire brigade approach. Why don't you have a kind of arrangement? Why don't you have a kind of immunization before the time? If we will have the immunization before the time, I'm sure the people will develop immunity that will protect them against this meningitis, if that's the case. And why are we procuring the vaccine if we are not going to immunize the people that's supposed to be given the immunization?
You have to wait for outbreak before you release this vaccine. You have to wait for an outbreak before you can do it, because these are something that you're supposed to inoculate people before the outbreak. So why do you have to wait for the outbreak before you release the vaccine?
As a matter of fact, from our own end, I told us the pillars of IMS which had just been activated. So I told us that we have surveillance and risk assessment, and one of it is communication. So we have our communication experts from all partners that are assisting us. They meet every day and disseminate information to all to the public, including schools, because if you look at this particular outbreak, it's actually affecting children, age group of 5 to 14. And you know that age group of 5 to 14, they will either be in primary school or secondary school. So most of our communications messages are to those particular age group and their caregivers. But the vaccines aspect of it is being managed by FPCDA. So the second one is from my honorable man. NCDC just activated the IMS board, and we are coordinating all the states, especially the affected states, from our office. But each state have what we call RRT, Rapid Response Team. These are the teams that are domiciled in the Public Health Department of the State Ministry of Health, and they are getting in touch with us every day. We, from our end, we are coordinating the activities. We are telling them what to do, and they are giving us all the necessary information. And within a very short period, because we just started this on Monday, and we are assuring you that by the time you call us here, we will have told you that we have done ABC that actually make this, to combat this disease. I want the House to note that we in NCDC, we don't have staff. We just have very few staff. So most of the people that are actually assisting us are the partners. So we really need to have more staff in that area, and we are highly underfunded. We started this based on zero kobo, but the partners have been so much supportive. I told us during my briefing that we have our staff, including partners, in all those 5 states, and they are supporting the RRT in each of the states. All these logistics are being bought by our partners, so we really need support in this area from this House to be able to move forward. Thank you very much.
Thank you very much. The vaccines are very scarce and also costly, and the release of this vaccine must be approved by the international coordinating group through WHO. And before they make the release, there must be confirmation of outbreak. Otherwise, they don't release it. It is not released unless there is confirmation of outbreak. Now, following the confirmation of outbreak, we solicited for the release of the 500,000 doses, and they were released and available to us last week. Thereafter, we began the distribution. So this is the scenario, and this also explains why the vaccination campaign is starting now. Secondly, rather, the next point is as regards why yearly vaccination in schools, we are not done and they need to do them. I take us to what I said briefly earlier. We have had a predominance of meningitis caused by type A. The scenario now has never happened here. And against that, we vaccinated, as I mentioned earlier, in all the states in the meningitis belt. This is why today you don't have meningitis caused by that strain. So the National Primary Care Development Agency, with all stakeholders, the federal government, including you, therefore has saved so many lives by ensuring the elimination of the predominant type A. Even in those states, that have a high number of cases, since the epidemic is spreading, we can still prevent the spread by the vaccination process, which is the main objective. Why meningitis in spite of vaccination? When one sees that in general consideration, vaccinations have been happening against various diseases, childhood preventable diseases, a number of them. Polio, measles, tetanus, pertussis, and other conditions. When we say vaccination, general like that, and the fact that vaccination can prevent meningitis, people will assume that the vaccination that is being approved in the appropriation of the federal government year in, year out would include those of meningitis. Meningitis vaccination is not part of the routine vaccination process for which provisions have been made over time. The need for immunization all the time. Well, I think I have also explained that. Do we have to wait for outbreak before the vaccine distribution? That has also been partly explained by what I said earlier. Basically, distinguished chairman, this is what we have to say. And we're also making plans towards containing this scenario, which has now emerged in our country. It means we are developing and devising strategies to prevent this type of...
This case would have come in the floor of the House, but because I was privileged to be aware that they wanted to present that case, and then I quickly called my deputy to be able to discuss that. So we didn't deliberate it in the House. But the office should find it as a duty to inform Nigeria about the necessary steps they have taken in making sure that they curb these meningitis diseases. And secondly, it has entered Abuja. It has entered inside Abuja seriously. And I don't know whether Abuja was among the areas you touched during your briefing. Because it's very, very important that in the seat of power, such things are happening, and we are now also informing the outside world about the necessary step we have designed to be able to take to curb this. That is the comment I wanted to make on this matter.
From what I read, about 5 people have even died, really. If that is really true, and like Honorable Osai said, then it's a big embarrassment to the nation that this thing is happening in the seat of power in the Federal Capital Territory. So you can really address us on that. Is that really true? Is that really rumor? Did it really happen?
Comment and questions made are in the purview of the Nigeria Centers for Disease Control, which is the agency of government that is leading on the effort in terms of epidemiology, in terms of general coordination, in terms of actions. And so therefore I will respectfully respect to you and statutoriness of our various responsibilities, take your permission to rechannel the response to him.
I want to tell us that we have sent some of our colleagues to FCT this morning when I received a letter that there was a particular case that came all the way from Sokoto to Abuja, and the person came on the 31st of March. Who was actually have a suspected case of was sick, and it was diagnosed to have a suspected case of CSM, and from there maybe he just escaped and came down to FCT and was admitted at Federal Medical Center Jabi, and on the 3rd of April the person died. So we immediately had this morning. We quickly sent our mobile team to the place now, and they are back to the office. So I'll give you details very shortly. But what was in the letter was the person left Sokoto on the 31st and was admitted in Federal Medical Center, Chabi, and died there. But before the person died, the sample was taken and was found to be positive. That was the letter I received. So I quickly set up a small team, and they have gone there. So they're going to give me a report this evening, and I sent, because I have a letter you actually asked us to come here. So I will send the reports to the clerk of the house so that they will know exactly the case. My counterpart from SPCD said they have given 5,000 doses, and from there we'll take it up. We'll do the investigation. We'll do active surveillance, and we'll ensure that nobody is being affected. Already, communication messages are going out, usually in Abuja here, both on social media as well as print and electronics. So we believe with this, we'll be able to curb it. So more information will be given to us, and then as we receive the information, the situation for today, we will send it to the chair for the chair to know. But for now, it's only one case we had. We have not confirmed it from our office.
No, I don't think so. I don't think it's only one case. The one you're talking about coming from Sokoto is a young person. Okay. We have other cases, about 3. Somebody died there before yesterday on these issues of meningitis. The House want to have a comprehensive details of the report, state by state. This committee intends to make that report, because it was a promise we made to the General House. This committee intends to make that report by Tuesday, and we need this report. Mr. Chairman, let him be a directive, to them that this committee will need this report on or before Friday, so that we can be able to use that report as a tool in briefing the House, whether there's any other extra intervention the House is going to make, because we understand the plight of our country. We represent constituencies, and they must be briefed by what is happening.
we have what we call CTREP that goes out aid that is already in your house, and we believe we are going to do justice to it in time, because that one has been giving us a lot of constraint to really work the way we're supposed to have worked. And then we are actually underfunded too, because when this outbreak started, we have not been mobilized. So we have been going out to the global world, USCDC, UNICEF, WHO, that have actually been assisting us. So we believe that if this bill is in place and has been signed and gets ready, then we'll be able to do more than what you are even expecting us to do. Because presently we don't have staff at all, and we cannot really recruit or get any staff unless we have the people. The people that are actually working with us are the people that are seconded from the Federal Ministry of Health, and they are very, very skilled. So we really have a lot of trouble. We are highly constrained. So we want this honorable house to please look into it. We are ready to work. We did it before in 2014. I was part of the coordination that time for this Ebola, and we were successful that time because we had much staff working with us, but now we don't. So this is our story. And the reason why we are constrained was because our bill was not yet in place.
You have coordinated for Ebola. Is that's what you said?
Yes.
So where are the strengths that you used to manage Ebola?
In fact, during that period, we have during that Ebola period, we have global.
Before the discovery of oil in Nigeria, agriculture was the mainstay of Nigeria's economy. It contributed massively to Nigeria's gross domestic products and external reserve, and thus became a major revenue earner to the government. The impact of agriculture on Nigeria's economy was quite enormous and significant to the extent that certain food crops in Nigeria were readily identified with their areas of production. With the discovery of oil in commercial quantities in the 1970s, however, oil and gas became the main focus and agriculture was virtually abandoned, resulting in decrease in food production, decrease in earning from agriculture, and eventually lack of interest in farming. Thanks to the efforts of past and present administrations in the country that have revived agriculture to boost food production.
Agriculture was not only contributing to the mainstay of the economy, it was also a major source of domestic and international food production, feeding the ever-increasing population of Nigeria, which is today increasing at alarming rates. Aside from GDP contribution, agriculture has been a major livelihood activity of the people in the rural area, which agriculture as an economic activity is known to recite. Besides contributing to income and means of livelihood, which major people are depending, it also serves as a major contributor of Nigerian labor.
Agriculture is one of the areas that is providing food to the